Let me tell you something that took years of clinical practice and hundreds of hours of peer-reviewed literature to fully understand, and something the pharmaceutical industry has spent billions of dollars making sure you never figure out on your own. Right now, inside your knee joint, there is a biological process unfolding that has nothing to do with age, nothing to do with genetics, and everything to do with a specific molecular cascade that modern medicine has been managing with blunt instruments for decades. I'm going to show you exactly what that process is, how it works down to the receptor level, and then at the very end of this video, I'm going to give you the exact protocol, the precise ratios, the correct application technique, and the one timing variable that determines whether any of this actually works or just sits on the surface of your skin doing absolutely nothing. That timing detail, the one piece nobody in this space is discussing, is the difference between a 73% reduction in inflammatory markers and zero results. So stay with me, because we're going to get there, and when we do, it's going to completely change how you think about joint health for the rest of your life. Every single day, more than 30 million Americans swallow ibuprofen for joint pain. 30 million. And most of them don't know that a landmark review published through Johns Hopkins found long-term NSAID use increases gastrointestinal bleeding risk by 400%. Not 4%, 400. And that's before we even talk about the renal toxicity data, the cardiovascular risk profiles, or the fact that none of it, not one pill, is addressing the actual root cause of what's destroying your joints. That information isn't buried in some obscure journal. It's sitting right there in the published literature. But nobody's telling you because the entire model of conventional joint pain management is built around symptom suppression, not biological restoration. And that distinction is everything. So let me give you the real picture of what's happening inside a deteriorating knee joint. Because once you understand the mechanism, you'll see exactly why the conventional approach is doomed to fail, and why what I'm about to show you operates at a completely different level of biology. After 50, your body's production of synovial fluid, the viscous, lubricating liquid that fills your joint capsule and allows cartilage surfaces to glide against each other without friction, drops by approximately 60%. 60%. Your articular cartilage, the specialized connective tissue covering the ends of your bones, is avascular. It has no blood supply of its own. It receives nutrients exclusively through the diffusion of synovial fluid. When that fluid production drops, cartilage starts starving, literally starving. The chondrocytes, the cells responsible for maintaining and rebuilding cartilage matrix, stop receiving the glucose, oxygen, and growth factors they need to do their job. Waste metabolites accumulate inside the joint capsule. The extracellular matrix begins to degrade, and then inflammation moves in. What researchers now call inflammaging, chronic low-grade sterile inflammation accumulating in aging tissues, begins pooling in those fluid-starved joints. You can't see it on a standard X-ray. You can't feel it as a distinct sensation in the early stages, but it's running a specific molecular program. Inflammatory cytokines like interleukin-1 beta and tumor necrosis factor alpha activate matrix metalloproteinases, enzymes that literally digest the collagen and proteoglycan networks, giving cartilage its structural integrity. At the same time, nuclear factor kappa B, the master transcription factor functioning as your body's inflammatory gene expression on-off switch, gets locked into the active position. Once NFKB is constitutively active in a joint, you're in a self-reinforcing cycle. Inflammation drives cartilage destruction. Cartilage destruction drives more inflammation, and synovial fluid production keeps falling. That's the loop, not aging. A specific, identifiable, interruptible biological cascade. Here's what your doctor is doing when they hand you a prescription for ibuprofen or naproxen. They are blocking COX-2 enzymes, which reduces prostaglandin synthesis, which blunts one arm of the inflammatory response. One arm. Meanwhile, the 5-lipoxygenase pathway, a completely separate inflammatory cascade producing leukotrienes, keeps running completely unopposed. NFKB stays active. Cartilage destruction continues. Synovial fluid production keeps declining. And your GI tract, your kidneys, and your cardiovascular system absorb the collateral damage of systemic NSAID suppression. The drug isn't wrong exactly, it's grotesquely incomplete. It's like trying to stop a building from flooding by plugging one pipe while ignoring six others. There are specific plant-derived compounds, lipid-soluble bioactive molecules with documented mechanisms of action, that penetrate the dermal barrier, reach the synovial capsule, and intervene in the inflammatory cascade at multiple simultaneous points. I'm going to rank 8 of them for you, from least effective to most powerful, and be honest about the limitations of each one, because this channel doesn't do hype without data. Then we're going to build toward the combination that a peer-reviewed clinical trial demonstrated produced that 73% reduction in intra-articular inflammatory markers, with MRI-confirmed cartilage measurements. And I'll explain exactly how to replicate those results at home. Number 8. Coconut oil with cayenne pepper. This combination is all over wellness blogs, and there's a kernel of truth underneath the hype. Coconut oil is a medium-chain triglyceride carrier. Cayenne contains capsaicin, which works through TRPV1 receptor desensitization. It initially triggers pain-signaling neurons and then exhausts them, producing temporary analgesia. A 2022 study in the Journal of Pain Research confirmed topical capsaicin produced a measurable reduction in joint discomfort of about 8%, real but modest. The more fundamental problem is molecular. Coconut oil's triglyceride structures are too large to effectively penetrate the stratum corneum and reach the deeper dermal layers where anti-inflammatory compounds need to be bioavailable. You're warming the surface while the inflammation underneath stays completely untouched. One critical safety note that almost nobody mentions: capsaicin burns. Touch your eyes or face after applying this without thoroughly washing your hands, and you are going to have a very bad time. Never apply to broken or irritated skin. Score: 2 out of 10. Number 7. Sesame oil. It contains sesamin and sesamolin, lignans with genuine antioxidant and anti-inflammatory properties. A 2024 study in the Indian Journal of Pharmacology found sesame oil reduced inflammatory markers by roughly 12% over 8 weeks of daily topical application. Here's the nuance that actually matters. Sesamin requires thermal activation to achieve optimal bioavailability through the skin. If you're applying cold-pressed sesame oil straight from the bottle, you're leaving significant therapeutic potential locked inside the oil. Warm it in your palm for 30 seconds before application. Even warmed, its penetration depth is moderate. It reliably reaches superficial tissue, but struggles to cross into the synovial capsule in meaningful concentrations. Where sesame oil genuinely shines is as a carrier base for more potent essential oils, because its lipid profile doesn't chemically interfere with the active compounds you're layering in. A supporting player, not a lead. Score: 3 out of 10. Number 6. Olive oil infused with ginger and turmeric. Now we're getting into genuinely interesting territory. Olive oil contains oleocanthal, a phenolic compound that inhibits both COX-1 and COX-2 through a mechanism remarkably similar to ibuprofen, but without the systemic absorption and associated risks of oral NSAIDs. Ginger brings gingerols and shogalls, with documented inhibitory activity on prostaglandin synthesis. Turmeric brings curcumin, one of the most studied natural anti-inflammatory compounds in the scientific literature, with demonstrated ability to suppress NF-κB activation, that master inflammatory switch. A 2023 trial in phytotherapy research found this combination reduced knee pain scores by approximately 18% in 3 weeks. But curcumin's transcutaneous absorption rate is genuinely poor. Studies consistently show less than 5% of topically applied curcumin crosses the skin barrier without a penetration enhancer. The majority of that beautiful golden paste you're rubbing into your knee is sitting on the surface doing nothing. And turmeric stains your skin, your clothes, your bedding, a persistent yellow for days. Score: 4 out of 10. Number 5. Castor oil with peppermint essential oil. This one surprises people, and it surprised me when I first dug into the mechanism. Castor oil is approximately 90% ricinoleic acid, a hydroxylated fatty acid that binds directly to EP3 prostaglandin receptors in peripheral tissue. No other common carrier oil does this. When ricinoleic acid occupies those EP3 receptors, it directly modulates local inflammatory signaling. A 2022 meta-analysis in the Journal of Ethnopharmacology found topical ricinoleic acid reduced localized inflammation by 28%, and the effect begins within 20 to 25 minutes of application. This isn't gradual accumulation, it's rapid receptor-level pharmacology. Add peppermint essential oil. Menthol activates TRPM8 cold-sensitive receptors, producing an immediate cooling and analgesic sensation that blocks ascending pain signals, while the castor oil simultaneously works on the inflammatory mechanism underneath. Cooling signal suppression layered on top of receptor-mediated inflammation reduction. The critical ratio: 4 drops of peppermint essential oil per tablespoon of castor oil. Never exceed this. Never apply peppermint essential oil undiluted. It will cause chemical burns. Score: 6 out of 10. Number 4. Black seed oil combined with eucalyptus essential oil. Criminally underrated. Black seed oil, Nigella sativa, contains thymoquinone, a bioactive compound with one of the most mechanistically interesting anti-inflammatory profiles in the natural pharmacological literature. Thymoquinone doesn't work downstream in the inflammatory cascade the way most compounds do. It works upstream. It directly inhibits NF-κB by preventing 2-cap-B kinase phosphorylation, meaning it shuts down the entire inflammatory gene expression program at the source rather than mopping up individual mediators after they've already been produced. A 2022 study in the Journal of Inflammation Research found thymoquinone reduced knee joint inflammatory markers by 34%. Now pair it with eucalyptus essential oil. 1,8-cineol acts as a penetration enhancer and vasodilator, increasing blood flow at the application site by up to 40% and driving the thymoquinone deeper into the joint capsule than it could reach unassisted. The ratio: 3 drops eucalyptus per tablespoon black seed oil. Important caution: thymoquinone has mild anticoagulant activity. If you're on warfarin or any blood-thinning medication, consult your physician before using black seed oil topically. Score: 8 out of 10. Number 3. Jojoba oil combined with frankincense and lavender essential oils. Jojoba got famous in skincare for mostly wrong reasons, which caused researchers to dismiss it. A mistake, because its pharmacokinetic profile for transdermal delivery is genuinely remarkable. Jojoba is technically a liquid wax ester, and its molecular structure is so similar to human sebum that your skin's barrier doesn't mount the resistance it does against conventional oils. It absorbs almost completely, carrying lipophilic compounds significantly deeper into tissue than most carrier oils achieve. Mix it with frankincense, Boswellia serrata, and you're getting boswellic acids, particularly AKBA, which inhibit 5-lipoxygenase with potency repeatedly confirmed in clinical trials. Remember, ibuprofen only blocks one arm of the inflammatory cascade. Boswellic acids hit the other arm, the 5-LOX pathway, producing the leukotrienes that conventional NSAIDs leave completely untouched. A 2023 study in BMC Complementary Medicine found jojoba with frankincense and lavender reduced self-reported knee pain by 38% in 14 days. The lavender's linalool is not in this formula for fragrance. It increases transdermal absorption of co-applied compounds by up to 22%. It makes everything else work better. The recipe: 2 tablespoons jojoba, 4 drops frankincense, 3 drops lavender. 60 seconds of firm circular massage around the entire knee capsule. Score: 8.5 out of 10. And here I need to stop and ask you directly. If this level of mechanistic detail is what you've been looking for, the actual biology, not marketing copy, then subscribe to this channel right now and hit the notification bell, because the next video on mitochondrial health and NAD+ metabolism goes just as deep, and you are not going to want to miss it. Subscribe now, and let's finish this. Number 2. Mustard oil combined with camphor and clove essential oil. This is where we cross into serious therapeutic territory. Mustard oil is the highest natural source of allyl isothiocyanate among topical carrier oils, a compound generating deep, penetrating thermogenic activity that reaches the synovial space and increases local circulation by up to 45% at the application site. That increased circulation delivers oxygen and nutrients to oxygen-starved chondrocytes and clears accumulated inflammatory waste from the joint capsule. Add camphor, which activates TRPV3 receptors to amplify and sustain the warming effect while triggering the release of peripheral endogenous pain-suppressing compounds, your body's own analgesia. Then add clove oil. Eugenol reduces inflammatory cytokine production with remarkable specificity. A 2021 study in the Journal of Medicinal Food found eugenol reduced inflammatory cytokines by 42% when applied topically to inflamed joint tissue, numbers that rival prescription topical anti-inflammatory formulation. The exact protocol: 1 teaspoon mustard oil, a pea-sized amount of camphor dissolved in the warmed oil, 3 drops clove essential oil. Firm upward strokes for 90 seconds. Then, the technique that separates this from everything else at this tier: place a warm, damp towel over the knee for 5 minutes. The controlled thermotherapy opens follicular pathways and transiently disrupts the tight junction barrier of the stratum corneum, driving bioactive compounds 60% deeper than friction-based application alone. The reason this isn't number one: mustard oil's persistent pungent odor and camphor's potential for contact sensitization with daily chronic use. 3 times per week, not every night. Score: 9 out of 10. Number 1. The Triple Relief Blend. Castor oil combined with frankincense and peppermint essential oil. Before I give you the recipe, let me explain why this specific combination does something none of the individual oils or pairings above can do on their own, because the mechanism is the entire point of everything I've built up to in this video. You've seen castor oil's ricinoleic acid, EP3 receptor modulation, direct inflammatory signal suppression, 28% localized inflammation reduction with rapid onset. You've seen frankincense's boswellic acids, 5-lipoxygenase inhibition, the inflammatory arm that NSAIDs leave completely untouched. You've seen peppermint's menthol, TRPM8 cold receptor activation, ascending pain signal blockade. Now combine all three in the correct ratio, and you have simultaneous intervention at 3 completely separate biological targets. EP3 prostaglandin receptors, 5-lipoxygenase pathway, TRPM8 pain signaling. The reason chronic joint pain is so resistant to any single intervention is precisely because blocking one pathway allows the others to compensate. When you hit all three simultaneously, there is no compensatory mechanism. The inflammatory cascade has nowhere to go. A landmark study in the Journal of Clinical Rheumatology examined participants over 55 who applied a boswellic acid and ricinoleic acid combination daily for 30 days. The results: 73% reduction in inflammatory markers within the joint capsule, 61% improvement in self-reported pain scores, 54% increase in measurable range of motion, and the finding that changed how I think about topical joint therapy: a measurable increase in cartilage thickness on MRI imaging. Cartilage actually rebuilding, not pain that was quieter, actual structural regeneration confirmed with objective imaging. That is not symptom management. That is biological restoration, and the difference matters enormously. The exact recipe: 2 tablespoons cold-pressed hexane-free castor oil, 5 drops frankincense essential oil, 3 drops peppermint essential oil. Blend in your palm for 30 seconds. Total cost: under $5 per month. Now, the piece I promised you at the opening of this video, the detail that determines whether this protocol produces clinical-grade results or just makes your knee warm for an hour before accomplishing nothing. Application timing is not arbitrary. Nighttime application is the critical variable in the clinical data, and the reason is rooted in circadian biology. Skin barrier permeability, how easily lipophilic compounds cross from the surface into the deeper dermal layers, follows a 24-hour cycle. During physical rest, skin temperature stabilizes, follicular opening is maximized, and the tight junction proteins in the stratum corneum that limit transdermal penetration during active movement are at their most relaxed state. The oils have 6 to 8 hours of uninterrupted contact time without being mechanically disrupted by clothing friction, perspiration, or hand contact. The difference in bioavailability between nighttime and daytime application, accounting for all these variables, is not trivial. It's the difference between therapeutic tissue concentration and surface exposure that wipes off before it accomplishes anything. Apply the triple relief blend every night before bed. Warm your knee first, 2 minutes with a warm, damp cloth to elevate local skin temperature and increase follicular opening before you apply anything. This preparatory step increases penetration by approximately 30% compared to cold skin application. Massage the blend into the knee using firm, circular motions around the entire kneecap and behind the joint for 60 seconds. Do not wash it off for at least 4 hours. The compounds need sustained skin contact to achieve meaningful transdermal delivery. Buy cold-pressed, hexane-free castor oil. Hexane is a petrochemical solvent used in industrial oil extraction, and its trace residues interfere with the bioactivity of ricinoleic acid. Read the label. If there is anything on that ingredient list besides Ricinus communis seed oil, put it back on the shelf. For maximum impact across the week, layer in the black seed oil and eucalyptus blend, or the jojoba frankincense lavender combination in afternoon applications. Use the mustard camphor clove blend with the warm towel technique 3 times per week in the afternoon. Triple relief blend every single night without exception. Within 3 days, most people notice a reduction in the grinding sensation. Within 1 week, pain intensity begins dropping measurably. Within 2 weeks, stairs become manageable again. Standing up from a chair stops requiring bracing and breath holding. Within 30 days, the inflammatory marker reduction the clinical data predicts starts manifesting as real functional improvement. Walks you've been avoiding, activities you've been canceling, mornings that no longer begin with 20 minutes of stiffness before you can move normally. Let me be direct about what this is and what it isn't. This is not a cure for advanced osteoarthritis requiring surgical intervention. If your cartilage is completely eroded, topical bioactive compounds cannot regrow bone. If you have an inflammatory arthritis like rheumatoid arthritis being managed with biologics or DMARDs, do not modify that treatment based on anything in this video without physician supervision. If you're on anticoagulant therapy, the frankincense and black seed oil both have mild anticoagulant activity. Your physician needs to know you're using them with regularity. What this protocol is, for the population it fits, is the most mechanistically complete, evidence-supported, cost-accessible topical anti-inflammatory intervention currently documented in the clinical literature for chronic knee joint inflammation and early to moderate cartilage degradation. It hits pathways that pharmaceuticals leave untouched. It costs a fraction of over-the-counter pain medications with none of their systemic risks, and it works with your body's biology rather than overriding it with receptor-saturating drug concentrations that demand escalating doses over time. Your chondrocytes, given the right biochemical environment, given reduced inflammatory load, given restored nutrient access through improved synovial fluid dynamics, will begin the repair process your joint has been trying to run for years without the raw materials it needs. The cartilage data from that clinical trial is not a miracle. It's what happens when you stop poisoning the environment and start supplying what the tissue actually requires to do its job. 2 tablespoons cold-pressed castor oil, 5 drops frankincense, 3 drops peppermint. Warm skin, every night, 30 days. Your biology will do the rest. If this changed how you think about your joint health, subscribe and hit like. We're here to give you the real science.